think, again, like with any surgical process, there is going to be a risk of complications. And even though, overall, I've called some of these effects more like a side effect from the surgery, but it is really important that, we discuss this carefully before the consultation, so patients are not coming with any surprises or unexpected, expectations. So some of the more common, as I said, side effects that people talk about will be the numbness around the breast, because with any surgery that we go through the breast tissue, it is normal that the area will feel quite numb for anywhere up to 6 to 12 months, and sometimes there could be some permanent numbness as well, and that includes in the nipple as well as the breast skin area. Other sort of things that can happen, probably quite generic to any operation, will be risk of infection or bleeding or fluid collection, which generally can be managed quite easily in the outpatient setting without a repeat admission or surgery. But obviously there could be some more serious infection that may require readmission to the hospital. Some of the other more, serious side effect with the breast reduction surgery is to do with the changes in the blood supply to the breast skin as well as to the nipple area when we do the rearrangement of the pocket as well as the breast volume. And if there is any significant changes in the blood supply that is unanticipated, then that could lead to what we call skin necrosis or nipple necrosis, which again, we can often just do some dressing to try and improve the sort of healing process. But every now and then it may require return to the operating theatre as well. I think one of the other sort of common issues for younger patients who are contemplating for breast reduction surgery is that they may not be able to breastfeed in the future. So again, that's a pretty important point to discuss if that was a important priorities for the patient. Again, any changes secondary to pregnancy as well as further significant changes in the weight, and we're talking about probably more than 10 to 20 kilos of the weight changes. It may also changes the result of the surgery as well. So I think these are the common side effects, complications that anyone needs to consider if they're going through breast reduction surgery.